Assalamu alaikum, everyone. Peace be upon you. First and foremost, I would like to praise Allah subhanahu wa ta'ala Almighty, the most precious and most merciful for His blessings and His greatness for giving me the strength and courage in completing this practical work. Thanks everyone for joining today. To position myself and showing up the practical placement work, I'm Sanjida Marium Hridi. I was born and raised in a South Asian city called Dhaka from Bangladesh. My ancestors came from Yemen, southern end of the Arabian Peninsula in Western Asia, to preach the light of Islam in Bangladesh. And I'm an international Master of Public Health student focusing on Indigenous people head at the University of Victoria. So before starting my presentation, I want to gratefully acknowledge and show my respect towards the Likunga speaking people on whose unceded tradition theatre the University of Victoria stands, and the song his Skyoman and Sanic peoples whose traditional relationship with the land continues to this day. Currently, I'm living and presenting from here at the university premises, and I'm going to share one of my learning throughout the practical journey and sharing my work in making the Indigenous peer-reviewed e-learning module on culture safety for BC Network Environment for Indigenous Health Research. So my practicum work was completed by the BC NIR here at the University of Victoria. The organization is Indigenous-led with their main goal is to facilitate and support in capacity for an engagement in Indigenous-led health research that is open from the values, knowledge systems, protocols, priorities, and leadership of Indigenous communities, collectives, and organizations. Academic researchers and students in BC. One of the main BCNR activities is to uphold the culture safety and culture humility that is modeled by the work of FNHA. The BCNR is guided by three partners named FNHA, BC, AAFC, and Native BC Nation, which are Indigenous governed and community-led leading research organizations across BC. And currently, BC NIR has planned to develop learning modules with their partners who are Indigenous scholars in their respective fields that will be laid to an online training issued with a certificate in culture safety for researchers and all kinds of learners. So my practical placement starts from here and develop an e-learning module for the BC NIR organization. And I'm grateful enough to be a part of this work. And the next slides will demonstrate all the ideas and information about it. So first, I'm going to discuss what is culture safety and why it is important. The principle of culture safety is within an ethical space that is safe and respectful for Indigenous peoples. The notion of culture safety is a relatively new concept within the academic research environment, but it is the most familiar concept in healthcare settings to date. So this powerful concept is often not highlighted enough in academia while conducting Indigenous research. It is becoming a vital topic to include in those settings. The term was first introduced by a Maori and Indigenous nurse who worked in the healthcare setting in New Zealand. This concept has become so popular that it was widely used internationally to address not only health inequalities, but also to achieve social justice in various sectors from medicine to social work. In Canada, the culture safety concept was primarily used for First Nations healthcare, as you can see in the picture here, and it was then used for diverse social groups and their peoples across the country. Culture safety is not just a practice of ethnoculture. Moreover, this concept points out the need for the development of critical consciousness toward the power differentials inherent in the healthcare system, as well as the broader socio-historical and political factors that shape healthcare and Indigenous health. As Indigenous peoples, both physical and mental health were deteriorating after the colonization, oppression, and marginalization, and losing their rights and roots, many Indigenous organizations were actively working to establish a culturally safe environment. The ongoing education system is not enough to change these decolonizing methodologies and epistemologies within a largely dominant Western academia. So let's talk about how I developed this e-learning module. Mainly for making this, I use secondary data. The first one is from the BCNR organization using their 3 Indigenous scholars interview transcripts who are experts and scholars in these areas. And the second one is from the literature review of various scholarly Indigenous specific articles. Using all those resources and my own Indigenous knowledge, interaction with the BCNR Health Network Coordinator, and support from my practical supervisor, the 4 general themes were recommended, which I'm going to discuss in the remaining slides. The four themes from the data analysis based upon the rigorous searches for the e-learning module on cultural safety. The first one is self-determination, which is the ability of indigenous peoples or their community to self-govern, autonomously control their own decisions, and hold power to make their own decision. And the second one is capacity building, which is the ability to effectively improve and create any opportunity for indigenous researchers that demonstrate effectively learning for this learning module. And the next one is addressing the barriers that has two parts. One is mindfulness, which is addressing present, past, and tackling the future barriers to successfully able to publish, to being mindful about culture and traditions of indigenous peoples before taking any actions for giving services, care, and facility. And another one is the systematic barrier, which is addressing the structure and systematic barriers that experience while getting facilities in the mainstream Western dominant system. And the last one is reciprocal relationship building, which is making a strong connection to the land and the ability to build a reciprocal relationship that is instituted to the indigenous sense of self and wholeness. So here is the summary of the findings from this practicum work on all the recommended four themes of cultural safety. So I just want to talk briefly about that, from the interview transcript, indigenous experts explain the culturally safe review can be possible if the indigenous scholars get the independence to publish their knowledge and expertise that lies within indigenous sovereignty, autonomy, improving self-sufficiency and academic accountability and building equal partnership. For capacity building, indigenous scholars pointed out that to support indigenous researchers and reviewers, many processes need to be established to reinforce the academic writing community, including more indigenous focused publication and reviewers from indigenous scholars in the editorial process to build capacity within the indigenous community. The historical past of colonization continues to date, but it is high time to focus on contextualizing work for indigenous researchers. As such, mentorship can be the best solution and needs to be highlighted more and more by indigenous research scholars and community knowledge holders to guide both the new and existing researchers. The third and most important one is the address barriers. Indigenous experts highlighted the importance of addressing indigenous scholars when making their submission in various journals, too often getting negative feedback or racist comments that are received from the review boards of Western academic journals. Most of the reviewers often do not understand the indigenous perspective without giving the right amount of respect and their lack of indigenous knowledge. The next one is systematic barrier. The indigenous scholars noted that there is a need to recognize and involve the indigenous knowledge holders who are solely connected to the community in the peer review process to make it ethical and anonymous peer review process of the journal and assumptions from Western academic tradition for a high quality publication is also a strong barrier. The next one is reciprocal relationship. Indigenous experts suggested making a deep connection with indigenous knowledge from within indigenous communities is an important learning as self-location to rebuild relations to this day to the Western world. That is something so important even in the peer review process to relate to their roots and build a good relationship with the Western academic setting so that the academic writings will be given more value when reflects their core culture and traditional belief system that are lies in. That way, it can easily make a connection to the Western worldviews with a more ethical way. So the importance of the peer review e-learning module is learning about cultural safety within the ethical review process. That is great opportunity, mostly for those who are reviewing application for university level ethical approval for research projects, as well as other diverse learners who dive into this topic and take advice from the indigenous experts. I think the most important part of designing an indigenous learning module for researchers is to ensure that everyone is familiar with indigenous worldviews and knowledge, as well as indigenous research paradigm. And yes, okay, to engage indigenous community peoples by strengthening the indigenous knowledge systems in research by involving indigenous peoples in review boards and encouraging more academic writing that priorities indigenous worldviews in the center of the review board. And requires not only indigenous leadership and voices leading the inquiry approach, but also culturally safe space where indigenous ways of knowing are respected and valued in their knowledge systems. And finally, there is a requirement of the traditional science-based research community to recognize and respect diverse knowledge systems and a desire or will to work towards decolonization in the research realm. So my sincere gratitude to my School of Public Health and Social Policy, PHSP family, including all mentors and staff, especially my practicum course instructor and the director and professor of the school, Dr. Catherine Orrington, and the professor, Dr. Charlotte Lopi, and everyone whose name is mentioned here. And last but not the least, I'm also thankful to my family, my 5-year-old son, Sayedisa, as you can see here, and my mom and dad, my siblings, my nephews, Sadman Shafi, my relatives and friends, including my all MPH classmates whose continuous inspiration and love have helped me to survive and complete this MPH journey. Thank you everyone for your valuable time, for being here today, and stay safe, stay healthy, and stay connected. If anyone interested to more and get connected with culture safety related work and want to see the learning module in future, I would recommend everyone to sign up the BCNet organization newsletter or simply email the network coordinator for more resources. I'd welcome questions from the audience now.